Hello friends, you are welcome to my YouTube channel. I am Dr. Krishna Chaudhari, cosmetic surgeon practicing at Cosmetic Laser Surgery Center, Prasad Chambers, Karve Road, Pune, India. Friends, the abdomen is the most common area of the body to be treated by liposuction among both men and women. Important factors that affect the success of abdominal liposuction in females include importantly previous pregnancy, which tends to stretch abdominal muscles and loosen them and cause the lower abdomen to bulge to a certain degree. This curvature of the abdominal wall and muscles determine the flatness or the shape of the abdomen appearance. After liposuction, nevertheless, the vast majority of women who have been pregnant are ultimately very happy with results obtained by liposuction alone, and they do not require abdominoplasty in each and every case. Regarding cesarean section bulge, incisions in lower abdomen that is typically made for cesarean section or a hysterectomy but it is undesirable consequence of the incision is persistent bulge of fatty layer around just above incision. Liposuction can easily repair this annoying deformity and give a smooth appearance. Prior to obesity and subsequent weight loss, produce fat that is more fibrous. This makes liposuction more difficult. Location of abdominal fat is an important factor predicting the success of abdominal liposuction. Abdominal fat occurs in two different levels: superficial and deep. Superficial abdominal fat is located just below the skin and above the abdominal muscles. Deep abdominal fat is located inside abdominal cavity around intestines. Some people have more deep intestinal fat than subcutaneous fat. Subcutaneous fat can be removed by liposuction safely, but intestinal fat or visceral fat cannot be removed by liposuction because it would be very dangerous. Fat on the intestine can only be diminished by steady efforts to weight loss through diet and exercise. Successful liposuction is defined and determined by the degree of patient's happiness with the results. Ultimately, the patient's opinion of the cosmetic results depends on multiple factors, including patient's expectations, patient's preoperative cosmetic deficiencies, and surgeon's technical skills and techniques. Nowadays, instrumentation also matters. What surgeon has promised patient before surgery counts. Female patients have softer and less fibrous fat than men, and therefore liposuction on a woman is easier to perform. Fat on the upper abdomen is usually less of a concern than the fat on the lower abdomen. However, if the upper abdominal fat is either ignored or not suctioned or inadequately removed, subsequent weight gain will enlarge upper abdomen and give the appearance of a bulky midriff. Friends, fat removal has to be optimum to maintain the natural appearance and shape. Excessive fat removal from abdomen just to satisfy the patient by quantity can be a big mistake. Liposuction goal is not to remove as much fat as possible, but rather to produce a result that is cosmetic improvement and appears natural. This is the principle of liposuction I always follow. Swelling and soreness the day after surgery as a result of open drainage. Incisions are not closed with sutures. Of the blood-tinged anesthetic fluid and wearing a compression garment, the degree of cosmetic improvement is easily visible and quite dramatic over the next several days after the drainage has stopped. As the inflammatory healing process progresses, there is a gradual onset of swelling which decreases over the following few weeks. This firmness of the abdominal skin and subcutaneous tissue gradually decreases over 3 to 4 months after the surgery. Nature takes its own course. Open drainage technique, which I follow routinely, reduces swelling and soreness, requires the use of absorbent pads under the compression garment. Thanks friends. Please watch before and after liposuction of abdomen surgery photos. Friends, front and side photos taken before surgery shows various markings which help in giving good shape while removing fat, because in lying down position fat shifts, fat changes the position, and normally we assess ourselves in standing position. This procedure was done under spinal anesthesia and Timusant anesthesia.
After surgery photos show clearly how mid portion of body is very well shaped. There is no loose hanging skin. Three-dimension liposuction is very popular in local women as they want to look best in sari and blouse, traditional dresses in important functions. Washer and power assisted technology was used to get best results.